Experts say the journey to wellness begins with the skin.
Our skin is our largest organ.
The body's canvas and the armor that shields us from the world. And in an era where health and wellness are a growing part of the culture, the importance of nurturing this vital organ has never been more evident.
How to get rid of stretch marks? Like a dermatologist.
Enter Dr. Abigail Waldman, whose influence stretches far beyond the walls at Brigham and Women's Hospital.
I'm a board-certified dermatologist, and this is Use This, Not That affordable skincare edition.
She uses her social media platforms to talk about the complexities of skin health.
People said, I learned something, I did it, it worked, and that kind of inspired me to keep doing it.
From acne to aging and everything in between, she offers practical and evidence-based tips.
Can you use vitamin C serum if you have rosacea and sensitive skin?
Proper skincare varies across the ages, but chances are the teens and tweens in your life are part of the growing trend of young people prioritizing skincare.
I am going to build you a skincare routine if you are aged 12 to 13.
You're young, your skin is doing everything it should be doing. You should never be using anything that's labeled or marketed as anti-aging. Those ingredients are harsh. They can actually cause more harm than good if you're young and you don't need them.
As the years pass, skincare needs change.
If you're starting to notice wrinkles and age spots, your best bang for your buck is a retinol. You apply a pea-sized amount and start every 3 nights because this stuff is strong. So it works, but it can be very irritating.
But for every age and every skin type, doctors say,
you should wear sunscreen not just because of wrinkles, but because of the increased risk of skin cancer.
Sunscreen is the non-negotiable hero.
Regular use can reduce the incidence of melanoma by 50%.
Those of us with brown and black and darker skin often think sunscreen isn't important. Well, it is.
People of color oftentimes find themselves struggling to be seen by a provider who looks like them. Nationally, only 3% of dermatologists have brown or black skin.
Every year they say, your PCP will say, you should have your moles checked if you have moles. I said, I want a doctor of color. And they said to me, if you find one, you can go there. We'll give you the referring.
But there is a program at Brigham and Women's Hospital aiming to change that.
I think that the training in dermatology has been very Eurocentric. We realized that there was a need for specialized skin care.
Dermatologist Dr. Deborah Scott is the co-director of the Skin of Color program.
This is your area of concern.
Yes. A program that has been a pillar of progress for the last 15 years.
Historically, patients with skin of color have been misdiagnosed and therefore not appropriately treated because people don't recognize sort of the nuances in darker skin tones.
The clinic covers everything from routine skin checks to cosmetic dermatology.
And if somebody were to get treatment from somebody who doesn't look like them, are there specific questions that they should be asking about their background?
Anyone who is considering laser hair removal, discuss in depth with the person who's going to be doing it their experience in treating darker skin tones, because there's certain lasers that you don't want to use in darker skin because they can cause really serious problems.
But it's not just about the patients here.
This is Dr. James, one of our residents who's in training, one of our dermatologists in training.
It's also about educating the future caregivers.
We start our trainees in the Skin of Color clinic so that they start their training aware and learning of different skin types and how to treat them.
Patients like Bernadette.
So we're going to start right here,
Okay.
out towards the side of your face, which will give you this lift.
Who visits Dr. Scott for both routine care as well as cosmetic touch-ups.
1, 2, 3, pinch.
My cheekbones are high. Part of my ethnicity is Native American. And so I still wanted to keep that lift. So she just gives me a little touch here and a little touch here of a filler. And I just love it. I walk past the mirror and kind of catch that little glance and go, ooh, girl, you still looking good.
So you're here, your primary care doctor was concerned about some things that you had on your face,
Yes,
huh?
that's
Okay.
correct.
and Tyra, who found Dr. Scott after struggling to find a doctor who looked like her.
These are very common as we get older, and they're just how our skin matures.
Okay. Finding someone where the conversation starts in the middle of the sentence, that's the way I like to put it, makes all the difference in the world.
And back to Dr. Waldman, who we met earlier. She said being on social media has really opened her eyes to the myths and misconceptions that so many people have about skincare.
Yeah, one common myth that she gets is that sunscreen actually causes skin cancer and it's riskier to use it than to not to use it. This has proven not to be true. Dr. Waldman suggests if you want to use a sunscreen without some sort of chemical base, she thinks try a mineral sunscreen like with that would have zinc oxide in it.